How are we going technology-wise? All right, have you got your words to say? Yeah, you call it when. I'll get Marissa. Do you want to come up?
Yes, that's right. I see that the shop has up there. It'll take a little while. So that's all right. Yes. They'll have to email me, or I'll have to take it. Yes, but I can, if you want me to send over the information so that they can register.
Okay, good evening everyone. Sorry for the delay. Like a lot of other people in Australia, Facebook has let us down, and we're trying to get on through an alternate source, and Bill has worked very hard on this, but at the moment we're not there. But if I could welcome everyone here, and we're not online, and acknowledge Dr. Marissa Patterson, MLA, Julia Jones, MLA, and Emma Davidson, MLA, all for Murrumbidgee. You're all very welcome. We will have David Jones, I'm not sure whether he's here yet, the Executive Director of ACT Health, coming along later to present on the Canberra Hospital Master Plan. But I'll ask Bill Gemmell now if he'll do the acknowledgement to country.
Good evening, everyone. We're honoured to be meeting on the ancestral lands of Aboriginal and Torres Strait Islander people. We acknowledge these First Australians as the traditional custodians of this land, whose cultures are among the oldest living in human history. We pay respect to the elders of the communities in the Murrumbidgee region and extend our recognition to their descendants, past, present and future. Thank you.
Thanks, Bill, for that. I've got apologies from Janice Paul, Simone Hunter and Shelby Schofield and Brian Helmsley, who's left us at the moment. If I'm a bit rattled, it's because the painters arrived at 7 a.m. I had to move my car out, put it on the road. At 10 a.m. the carer arrived. At 10:10 two gardeners arrived to trim my trees. At 10:30 our care manager arrived. At 11 o'clock the curtain lady arrived. All there at the one time, and then at 2 o'clock the washing machine man came and stayed till 5. So it's been an interesting and busy day in the Anderson household. But I asked Marissa if she'd come along and speak to us. I think it's interesting when you start as a fresh MLA, you might get some insights into what it's like and what it means for someone like that. So Marissa, you're most welcome. One of our MLAs from Murrumbidgee, and I'll just hand it over to you.
Thank you very much, Tom, and thank you everyone for having me here this evening. I was telling Tom I was way over excited to get here and raced out the door, and it was 7 o'clock rather than 7:30, so I went back home for half an hour. Anyway, it's lovely to be here, and I'm a new MLA, so the last few months have been very eye-opening, and I've been learning every single day, going to the office, learning so much about all the programs that are run here and how all the different processes in the assembly work, which is going to take me a while to get my head around. So I guess for people who don't know me or how I came to be here, I've lived in Weston Creek for 15 years now, in Weston, and then I did a year over in Wright, and then I've been in Warramega for a couple of years. Absolutely love Weston Creek. I have 3 children and they've all grown up here. So prior to entering into politics, I was a researcher at ANU. I ran the Centre for Gambling Research and have spent most of my adult life working between the ACT and the Northern Territory, working in remote Indigenous communities. So I guess I got to the point where, and this was before COVID, it was important for me to really be investing in my local community, and that really became apparent, particularly with the working communities where, you can be flying in, flying out all you like, but really it's the people on the ground that are making the difference. So that's where I sort of turned my attention to the local community, and the work that I really loved doing with the Gambling Centre was the ACT work. And that's where I really felt I had an opportunity to have an impact and to make a difference. And so I guess a year and a half ago now, I joined the Labor Party, and relatively soon after that put my hand up nominated to run as a candidate in the last election. And pretty much it was my first election ever, and it was a COVID election, so it was very interesting, but it was fantastic. It was the best experience ever, regardless of the result for me, and just an amazing opportunity to really invest locally, get to know the community, understand what the issues are. And so, I was lucky enough to be elected, and are incredibly grateful to be now representing the community, and and working with the other MLAs. That's been also a really fantastic experience, and going to be a fun one over the years. So I guess in terms of a bit of my interests and background, I'm really passionate about mental health issues and addiction. I've been working in that space with the gambling work for a long time now. I also really see gaps in how we look after older people in our community. I think COVID really highlighted that. It was older people and younger people where I think a lot of support needs to be going or should be going. And I understand that aged care is a federal issue, but I think there's a lot we can be doing at an ACT level to be supporting older people in our community. So in terms of the assembly work, I am on 2 committees, or 3 actually now. I'm on the JAC, so the Justice and Community Safety Committee, so that will be an interesting one, which Jeremy Hansen is chair. And I'm also chair of the Environment, Climate Change and Biodiversity Committee. So again, that will be a very interesting committee, and I think very relevant to the sort of, I guess, where the ACT goes in environmental policy and addressing climate change over the next few years. In terms of how I want to present as an MLA, I really strongly encourage people to contact me. It doesn't matter what your political views are. I'm interested to know what your views are on the community and what the issues are and what your perspectives are. And I'm always really open to having a conversation, and I do want people to come and talk to me, and I do want to understand thoroughly what the issues are. So I guess I will be regularly out and about doing mobile offices, so down at Coolman Court, normally on the Woolworth side is kind of my preference of the side. I'm more than happy to meet people for a coffee, and I'll be posting on Facebook when I'll be doing the mobile offices, and they'll be every week or so, every couple of weeks, but I'll publicise them. In terms of the first 2 sittings of the Parliament last year were about inaugural speeches, and really my head was spinning just trying to take in everything that was going on. So these last sitting week, which was a couple of weeks ago, was a bit more, I had a bit more of a grasp of what was happening. But that was my opportunity to bring a motion to the Assembly, which was my first motion, and that was to call on the government to establish the Molonglo Valley Community Council. So that was fully supported by all the parties in the Assembly, so that was passed basically, which is very exciting for Molonglo Valley residents, and I think, you know, very much acknowledging the work that Weston Creek Community Council has done over the years in advocating for Molonglo residents. And I think now that they've kind of got to a critical mass in numbers of people, and you know, I think it is the right time that they now establish their own council and deal with their business over there. So I think that will be really interesting to watch how that progresses. Couple of things in terms of the Brearley Street upgrades and the Duffy shops upgrades. So I'm really keen to get you information on what is happening. I don't know who's got smartphones here. If you don't, I can still register your details if needed. But you can, similar to the COVID things, I've got these QR codes that you can register to the mailing list, one for Duffy shops and one for Brearley Street, and I will send you information on everything that's happening there, when you can, when the consultation process will start and how you can get involved. And also, similar to what the council's done, well, you've done a survey, I probably won't do that now that you've done it, but just trying to gather as much information on what people want to happen and what ideas people have, and then we can feed that back when the design process starts. So those two things will be happening starting this year, which is very exciting. The bulky waste service, so that's one thing that will also be starting mid-year, and that's sooner than expected. So that will be rolled out Canberra-wide from July. So if you have bulky waste, you have you're able to call up. There's a number, and they'll come around and collect it. So I think that will be a great service going forward. Coolman Court mural, that beautiful mural up there with the birds. It's a lovely summer addition, I think, to Coolman Court, and hopefully, with the upgrades that are going to happen over the next year or so, I think it'll be, really exciting to see developments there. So, I guess, Tom, that's where I'm at and up to, and really excited to engage with the council regularly and with local people.
Are there any questions? Anyone have a question for Marissa? No?
I got off easy.
No.
No, okay.
Sorry, Marissa.
That's all right, Gil.
Can everybody hear me through this horrible electronic device? Marissa, thank you. I noticed you posted on our Facebook group a message today about getting people to slow down.
Yep.
I assume that was in response to the story on ABC Radio yesterday, or is it just a general put it out there?
I didn't hear the story on radio yesterday, so I'm not sure what that was.
Oh, there's a link on our Facebook group to that as well.
Okay.
And the link to the ABC. They talked about it from about 12:30 to 3 o'clock, about the crazy driving going around the place.
Right.
And locally made contributions.
Yep.
I might have put one in about Dixon Drive.
Yep.
Is my particular hate at the moment, because it keeps me up overnight.
Yep.
So I hate to think what speeds are being got up to down there. But you can tell them, like rubber all over the road the next day.
Yeah.
They've had a pretty good time. They must be lonely, because I don't know why else anyone would get out in the middle of the night and drive a car with crazy speeds.
Yeah.
But we've been talking about this in here for 2 years, that I can remember. We had 2 meetings with police. Tom and I met with Chris Steele. Chris said he talked to the chief police officer. When's something actually going to happen?
Yeah, so there's a new model, policing model that they're just recruiting for at the moment. So it's police services model, and I'm very happy to provide information about that. So basically this is a new model of policing where they will have police out in communities. When I spoke to the police about it, they said basically it's essentially like a return to country policing model where you should know your local police officer. It's based on a UK model that's been very successful, and it's about prevention, and it's about police not sitting in stations. It's about them being out in the community and patrolling it. Much better sort of, I guess, awareness of what's happening, and able to I guess if there's people doing things that they shouldn't be, potentially catch them in the act. The other thing is, so the post today was about speeding, and one of the things that the sort of donuts and the hooning late at night, that's one issue, but there is also a real issue of people speeding through these sort of, I guess, the roads that run around the suburbs, basically, the main roads. And yeah, it's not just late at night, and it is people going too fast. And the last 2020, there was 5,000 speeding infringements. Over 3,000 of them, that was people going 15 k's an hour and over. So like anywhere up to sort of high range speeds, over 45 k's past the speed limit. So I think police have been quite horrified at how people are speeding and not respecting the speed signs, and so they're doing a major crackdown at the moment. It's a 4-month campaign, I think, or 3 months maybe, and yeah, targeting speeding everywhere, and also trying to get people to reflect on their own driving and what speed you are driving through the suburbs. And so that's one thing. Another thing, and also, I do encourage people to call the police, to call Crime Stoppers. This is the way, I know it's really hard, and I'm going to ask questions about this too, is like, when you can hear cars doing things outside your house, and it's like, well, how do you can't get their number plate, or, it's very difficult to kind of report that. So, I think it's important that we ask those questions of police. What can we do to get that information to you so that these things don't happen?
Can I just observe
Yeah.
the number of people on that ABC program? I recommend you get something about it, listen to it.
Yeah, sure.
The constant theme was there's many police, but they don't actually do anything. They don't appear interested. Or they want us to go out and actually video the events before they move. So I'll leave that with you. It's no questions, just an observation.
Sure. Thank you, Bill.
On a TV show here. Is that right? Hi, I'm host. Can you hear me? Is that coming through?
I think so.
All right, hello. I've made a submission last year, I think, to Tom about speed limits.
Yep.
This is probably more a broad and general approach rather than the specifics of hooning and current behaviour, that sort of thing. And it's all about world's best practice on terms of speed limits in suburban areas and near suburban areas. I do this on a I'm from the pedal power advocacy side, so I've got people on the roads, there's that part of it. But there's also an environmental issue. It's probably noise, it's the big one. In our valleys, I think we do notice noise, and I don't think Weston Creek's unique in that. I can think if you lived over in Isaacs somewhere and listen to that 80k plus road going all day, all night, it's really dominant in that fairly narrow valley. Anyway, world's best practice now talks about lowering speed limits within the actual suburban areas themselves, and also reviewing speed limits for those sort of arterial joiners. And the challenge I'd suggest here in Weston Creek is our 80k roads, which is Hindmarsh Drive and Streeton, are now becoming through roads through Weston Creek from one place to another, because we are being absorbed into more central Canberra. So for instance, if you're a B-double coming from Fishwick going to Molonglo, the easiest route is to come straight down High Marsh, straight down the street and then into Molonglo. Now we didn't have that for a long time, and that changes very much the nature of what's going on around our roads. When those same vehicles are doing 80 kilometres an hour plus and competing with the mums and the kids going to schools, on-road cycle lanes, elderly drivers going from suburbs to Coolman Court and wherever the favourite, that sort of thing, it really changes the character, and I think we've slipped behind world's best practice at the same time. So I just say that, please back up what's already been said by Bill, is it's probably a review of what our speed limit should be, as well as the enforcement and the education.
Sure, and I can definitely feed that back to Chris Steele and ask him about that, because yeah, I mean, I think, yeah, times are changing and there's significantly more people here. I think there are other transport options coming. I think, you know, with light rail going to Woden, and, you know, there are the bus interchange there, the, you know, bridge in Molonglo, those types of big projects which will come on board over the next few years, which will again shift things and change things and a sort of push to get people onto public transport. But I agree, if you get people onto public transport, you have to support that with, you know, make it safe for people and, you know, make it work in their lives. So, yeah.
Thank you. Thanks, Bill.
Can you hear me?
Yes, just.
Okay, well, for a start, congratulations.
Thank you.
On being our newest, or one of the newest MLAs. Wonderful to have you. Just one of our local issues, of course. We had a big fight with the Labor Party, as you would know, about they want to bitumise the park across the road.
Yeah.
Now, what we'd like now, after winning that, having to take it to ACAT, etc., we would like a move to have the park rezoned as urban open space, and will you support that along with the Liberal members and the Green members?
So what I would say to that is, if that is to happen and if that's what the community wants, then there needs to be broad consultation about it and a broad discussion about it, because the thing is that everyone's calling for more community facilities, and if that at the moment, that land is community zone land. So I totally respect that people's views may change over years, that no longer do we want that community zone land, but there does have to be a broad question to the broad Weston Creek community. Are we happy as a community to let go of that land? Because that will know, yeah, if the zoning changes, then it'll be very difficult to get it back. So that is a potential site for a community investment. That I understand the residents' views, and I understand, you know, people's views on wanting green space, absolutely. But there is another conversation to have about community facilities, and it's a really important one as we grow. So I would be looking to be talking very broadly and widely and over a long period of time with the community about this, because I don't think it's something that we should rush into, but I respect people's, you know, different views on it.
Okay, fair enough. It's only been relatively rezoned from urban open space
Yes.
to this community facility.
Yeah.
And when we saw what had happened in the community facility, well, in fact, if you do the research on it, there's not much can happen with that block, because any building has to be 50 metres away.
Yeah.
And they would put them on pumps.
Yeah.
However, to protect the land, we will certainly be pushing for rezoning.
Sure.
Thanks.
And I'd be very happy to continue that conversation. Yeah. You're next.
I'll come to you next.
Yeah, well, as you know,
Just wait, just wait.
Oh, well, I think I was told I was next.
No.
Wasn't I told I was next?
We need the microphone.
Oh, yeah, but I don't want the microphone.
Well, we need it because we're broadcasting.
There are people watching online. They won't hear you.
John, question. Ask your question.
Is it me?
Yes.
Oh, sorry. Look, I apologise. I've had eye injections today, so everybody's a complete fog in here at the moment, and I'll do my best. Just on the question of community facilities, I wasn't going to talk about that tonight, but I think it's very relevant now that it's been raised. I think the government needs to take a much stronger hold on areas that they lease to people to ensure that that's the purpose for which they're used. And we just see so many very recent examples where the government's taken to the cleaners by developers, by owners of properties that are put up for sale, etc. I'll just give you a couple of examples.
Sure.
And I apologise for slightly going out of area here, Tom, but over at Coombs, there's a so-called community facility there that's part of, I understand, the childcare centre, or attached to the childcare centre. The guy who owns that has made it so difficult for people to use it that it's not a community facility, it's an empty facility.
Yeah.
We've got the shops, you know the story of them. Now, I've since had a look at the proposed community facility for Wright, which is diagonally across from the Coombs shops, next to Coco. I can't remember the size of the block, I've been over there a few times now, but it's a big block, it's like 4,000 or 8,000 square metres.
Yeah.
Now that was leased for community facilities. What the people there, Little Penguins, are putting on is a 4-storey medical centre, a childcare centre. Well, they say that's for the community. And guess how big the community hall come activity centre is? 130 square metres.
Mm-hmm.
On a block that's 4,000 or 8,000 square metres. I mean, the government's just got diddled again in that situation, and I think there's got to be a greater hold on what things are sold for and what they're used for.
Yeah. Thank you.
I've done my neck current class. So no, I'm always concerned about the NBC Act being breached the entire time, all through Malongla, and still being breached. We're losing the entire Malongla to developments, and they're all illegal. Light rail is illegal. It's all breaching the environmental laws. So what can you do to stop all of this, to stop this government breaking all the environmental laws?
Okay. Yes, I think you've asked this question before in the Western Valley Council meetings. So we do have laws, and at both we have environmental laws that the government does have to abide by. There are sort of environmental impact studies that are done for every bit of development, and the habitats of the flora and fauna are, broadly considered with every development application. So I think if you do have issues relating to that act, then I can refer you to the appropriate ministers, and they'll be able to provide you much more information than what I have.
They're exempting them all the time, and it's illegal to exempt them because they are legislated and the laws are there for a reason. There are ramifications for the government to be repeatedly breaking all the environmental laws. If you could step in.
Thank you, Nora. Is anyone else? One more?
Look, I can probably manage that microphone.
Yeah.
We need
Just going back to what Bill said on the speed limits, if ever those topics are raised on any of the local sites, everybody gets and has their 2 pence worth, and I'm not pushing any particular barrier there. In fact, I certainly don't push speeding in any way. I think there's a sense of frustration amongst people at the different speed limits everywhere. And it does make it difficult driving because you're always looking out for what the speed limit is, because they do change quite frequently, and I don't know, I guess there could be some value in that. Not to make people go fast, but to make it simpler. And I think we'd be better off watching the road than watching for signs in general. But look, and I'm not talking about the people who went at 130, I mean, they'll do that wherever.
That's right.
I think one place that probably really needs to have a look at though is John Gordon Drive, where it's 70 for most of it. Find that, look, I don't get frustrated by it, doesn't matter to me, I'm not narrow, but it's strange that that should be 70 on a dual carriageway, whereas street and drive down here is 80 on a much narrower sort of road, I think, in appearance and just in vision with trees and things. So I just draw that one to attention.
Yeah. I mean, I guess I'm not aware of the justifications for the different speed limits, but I completely agree with you that, you know, we could be doing more to promote the speed limits and, you know, what speed limits are where, and encourage people to drive at the speed limit rather than over. Yep, Bill.
Yeah, Bruce, I wasn't going to ask this. Sorry.
Yes.
I know you knew, so you forgive me if you don't know the answer, so we haven't dealt with the Planning Act.
Yes.
I had the misfortune of having to read it recently. And the regulations, and the territory plan, which is quite decipherable. Now there's some river paragraphs in there. The first sentence contradicts the second, or where there are Bible words, no reasonably educated people need to understand what they mean. But however, the decision-making provision doesn't really work like a decision-making provision in a lot of other bits of law I've dealt with a lot. This doesn't give the guidance to the decision maker on what to weigh up. So the decision maker can go and say almost anything, because then whoever's scrutinising has to weigh it through. Now this has got a non-cost for the people that disagree, the Willow Park people, for example, and us who joined it and waded through it and tried to understand it. There's a massive case going on with a few other developers a bit up the road. And these are all costs that are being passed on. My view is maybe it's due for a review, but with a better regulation hat on it, but also a better citizenship act. Tell the citizens what the weightings are in decision-making provisions. Tell the people what is considered. Have it all in there, one spot. Not having to go to the end of the regulations to a footnote to find out whether it even matters, and then find out there might be a contradictory provision in the actual act. And then to try to find out where the definitions are, some of which even apply in the actual plan.
Yeah.
So that's my bugbear of the week.
Yes. No, I can definitely appreciate that because I am also new to, well, I am new to the Planning Act. So I am trying to understand it and understand how it's implemented and how it works. And so I can absolutely relate to the complexity, and I definitely don't have an answer for you, but very happy to continue that conversation.
Oh, happy to.
Good. Thank you very much.
Thanks, Marissa, for that. I'll answer some of the questions that were raised later, but driving at speed, today, Perry Drive, 50 kilometres an hour, car comes up the hill past our house, overtakes another, cars parked on the side of the road, doing probably in excess of 80. And just an example today. Now, thank you for that. We look forward. Where's your
I've got the cards.
your cards?
Yep.
People might like to
Yep.
scan those. If you
Yeah.
maybe if you put them on the table there, and those that want to do that and find out about Tuffy and find out about Brearley Street, that'll be really good.
Yeah.
In the meantime, I'll ask David Jones, no relation to the company, I assume. Thanks, Marissa. Really appreciate that. Who's going to talk to us about the master plan for the Canberra Hospital. So, we're looking forward to this. Yeah, we'll just see if it works first. I'll hand over to you. I'll switch it. See if it works.
Thanks everyone. That's quite loud. Just try and get my presentation up to help fill in the evening, so that you're not just looking at me and listening to me, and we also had some good information on that. Thanks, Tom. It's always a bit nervous at the start. Thanks, Tom. Thank you, everyone, for having us. MLAs, lovely to see you here. I'd like to just quickly acknowledge the traditional custodians of the land. I have just come from the Ngunnawal Bush Healing Farm, and there's a lot of variety in working for the ACT government. At the end of that event, I was helping some neighbours fix a barbed wire fence on my way out, through to talking to you about the multi-million-dollar potential that we're going to have with the Canberra Hospital Master Plan. So thank you for your time in your schedule. This is the first phase of consultation for the Canberra Hospital Master Plan. The Master Plan will be an important document that will guide the future construction and development at the Canberra Hospital. Next slide, please. So, Canberra Hospital opened in around 1973, I think it was. There wasn't that much there in 1975, but then as we moved through to 2015, you can see that the campus has been developed. And next slide, please. And it really is quite different, with some really high quality infrastructure and services provided at what is the largest tertiary hospital in this region for both Canberrans to access and those in our local New South Wales region. Next slide, please, up. As our population continues to grow, services need to change, and the Canberra Hospital is no different with respect to that. The Canberra Hospital Master Plan will enable us over the next 20 years as we develop to guide the hospital in its development and the services that we provide there for the community to access. Next slide. So, the work that we are doing right now is listening to the community. So we really want to understand, we're not coming to you with options about how we think the campus should be redeveloped. Through this first phase of consultation, we're asking the community, we're attending community councils, we're talking with our peak bodies and representative bodies to understand those things that work and those things that haven't worked so well for people on the campus. Next slide. Next one. So what we've done so far. So we've done a whole lot of work on what's available on the campus, the age of the buildings, what services are provided there, how they sit within their environment, what kind of maintenance they might need. And we've also, because that's really important for developing the plan, obviously, for future development, we've also looked at previous ACT held consultations and feedback that we've had from the community. So we had intended to kick off this process around March last year, but obviously the pandemic got in the way of doing that, and we rightly paused that piece of work to let the Canberra Hospital and our Health Directorate focus on those important pandemic-related issues that we had at that time. So we've recommenced that now, but during that intervening period, we did a lot of work in trying to understand these things to help us develop the best possible master plan that we can for the Canberra Hospital campus. Next slide, please. We also did some important work around territory-wide health service planning. So that's the nuts and bolts of how you run the hospital. It's the services that are actually going to be delivered there. It's the surgeries, it's the allied health services. So it's the doctors and nurses in the hospital and what that's going to look like in the future and what demand might be for the future. Because our understanding that enables us to deliver the services that the community needs, and incorporating that in our master planning process helps us deliver the buildings, which helps us deliver those services. So, and we also worked with, so there's that territory-wide service plan process. There's also a Canberra hospital focus, which is the clinical hospital services that are developed at a tertiary hospital. So next slide, please. The things that we've heard, so I touched on before that we've looked at previous consultation. You know, community members have told us, you know, workers at the hospitals have told us that things like accessibility, wayfinding, traffic management, getting into the hospital and around the hospital, sustainability is important, the green space at the hospital and the provision of spaces for people to, in what can be a stressful life event, to remove themselves for some time from that and sit in some green space and have that free time. Vehicle parking as well, and next slide, Harvey. So we've heard all those things. We know some of those are concerns, and we're looking at those as concerns. We want to hear more though, so that's why we're talking at events such as these and listening. We've got a Your Say page, which is a well-known ACT government consultation mechanism that's set up with a lot of information to support us to hear from the community and workers in our health system about what we want to do on that campus. So the stakeholders, CHS, and all of these things we will consolidate through this first phase of consultation and come back, I think it is in early April, with some more options based. So this is it'll be like a listening report that we come back to the community and say, when we were talking to you earlier this year, these are the things we heard. This is how we think it's reflected in the canvas, and this is what we might be able to do about it. What do you think about these options for solving some of these issues? Next slide. So the master plan will really draw on those important things for the future of the campus. So how it contributes to health and wellbeing, how it contributes to environmental sustainability, how it can meet the advances in healthcare technology that we're seeing and the rapid development of those. You would all have probably participated in some telehealth services, as we've seen significantly roll out, for example, during the current pandemic. And also, what's really important for us is how is that campus connected to the community? So how does it relate to the community? How does the people who access its services or support others to access its service, how are they engaged with that campus? And how does the campus enable them to feel good about going to that place for what can be a really difficult thing? Next slide, please. So again, it'd be interesting hearing your views. We're talking a lot about the things that we want to hear. It's getting around the campus, it's public safety, it's that amenity and green space. How do you use it? What problems might you have when you use it? How do others use it, and what do you know about the issues that they may have had, or the things that worked really well and we should do more of? So it's that visitor, staff and patient amenity. You know, how does a nurse who might finish a night shift grab a 2-litre bottle of milk on their way home from a shop so that they don't have to go via multiple shops to, so that amenity for, or somebody who might be visiting, a family member, how do they do those things as well? We don't necessarily need a full IGA there, but some of the feedback we've had is, it'd be nice if we had a little corner shop sort of thing where we could get some milk or bread later at night. Next slide, Harvey. So we're working really closely with the Canberra Hospital Expansion Project team. So they're doing some fantastic work in that space. There's a lot of consultation with the community. So we are making sure that in our consultation and work with them, that all the master plan and the Canberra Hospital align. So the actual ability to move between that space and into that space and across the rest of the campus, we're aligning all those entry points, if you like, and making sure that the thing that we are developing here, is the Canberra Hospital expansion, is well reflected in the master plan that we're delivering. Next slide, please. So we really do want your feedback. We want your community's feedback. We want your family's feedback. The first phase of consultation is open through to the 10th of March. We've been doing a lot of social media and other media on this, going out to those community councils, as I mentioned. We're also having multiple pop-ups, and we have had multiple pop-ups around Canberra shopping centres. Importantly, we've got one coming up here at Coolman Court on Friday, I think it is. Is that right? Friday, 4 till 6. And then we've got another one at Denton Prospect this Saturday from 10 to 12. So that's an opportunity if you might know people who don't want to potentially put in some your say to come along and talk to some of the team that we have there who can talk through the process more, take down the details of what you might want to talk about and make sure that that's incorporated into our thinking around the master planning process. So where are we in this timeline of master planning? All that work from 2017 to 19 and 20, we'd worked around territory-wide service planning, and listening to others in the community about some of the concerns they've had. End of January, we kicked off this as a formal process, seeking formal feedback on how Canberrans want the campus to be developed. This first phase ends in March. We'll come back with that listening report in early April. And then mid this year, we expect that we'll have a final master plan, which we'll be able to provide to government. And then that will guide us through for the development of the campus over the next 20 years. So that's really, it really has been we're not telling you what's occurring on the campus, it's what do you think should occur on the campus? How have you experienced the campus in the past? How can it be better for you in the future? We're really keen to understand those things. Certainly, if we've got time, we can take some questions now. I might not have the answers to all those, but certainly we can take those questions now and we can include them in our master planning work. Great, a few questions? We do? Fantastic, thank you. We're just going to grab a laptop so we can make sure we get all the questions down as well. If you want to go for it. Yeah. Go for it.
Oh, yeah, okay. Yeah, look, I could be on my feet all now, but it's very timely you're talking about this master plan tonight on the same day that announcements have been made about light rail. I won't comment on people's various opinions on light rail, but I do find it very difficult to understand that the proposed route for light rail on the south side doesn't go past the hospital. The hospital's the most, busy, just the most busy place in the whole southern district, really, of Canberra. Not just at peak hour, not just during the day, but day and night, for all sorts of people coming and going, workers, patients who are mobile, people visiting them, all sorts of things like that. And I just find really difficult to understand that if there's an opportunity for light rail coming south, that it shouldn't go in front of the hospital and find some other route to Woden. The light rail in Sydney, if you've observed that, I used to come from Randwick, so I know it pretty well there. The light rail that goes to Randwick ends up right outside Prince of Wales Hospital, which is a massive complex. Canberra Hospital is pretty much the same, but just smaller. So I just think it's an opportunity that you folks need to talk to the light rail people and plan for the future. We see lots of instances, without knocking the government too much, where things have to be redone after they're first done. GDE extension, Horse Park Drive, Mitchell train station, Coombe shops. I could go on, and I'm not trying to be critical, but look, you've got the biggest establishment on the south side sitting there, and the rail's going to go straight past it with absolutely no benefit to any passenger on light rail.
I can talk to the work that we're doing on the campus. So certainly as a part of that development, we're doing traffic studies, we're working with Transport Canberra on making sure that we understand and can improve those things like public transport routes. And the traffic studies will help us inform that. How do you access the site safely? How do you get out of the site safely? What's the easiest way to park and move around the site? So there's certainly work happening as a part of the master planning process on that traffic management issue, and certainly those discussions with Transport Canberra about how you support people to access transport, public transport, to get to the campus.
Thank you. Julia Jones here. I won't ask a huge political question, but the bus stop at the hospital campus, do you know right now why it's closed in those discussions? On Hospital Road?
On Hospital Road?
Yeah.
So I understand that that bus stop was closed last year.
Yes.
Yes, as a part of the works that are occurring on Hospital Road.
So do we know if there's a current bus route? Is it go to the edges of the hospital, or does it go?
So there is a bus stop that's just off Auckland Drive. There is a bus stop within the hospital campus as well, and they're not on Hospital Road. And there is a shuttle bus that the Canberra Health Services operates. I understand.
Okay, thank you.
Can I take that a bit further? Do you know if all the bus routes go along the same way through the hospital precinct or not?
I don't know that, but if you've got a specific concern, we can take that, and in our discussions with TCCS, we can say this is the kind of feedback that we've had on bus routes into the hospital.
Yeah, I do.
Yeah.
I was over there the other day, driving. Unfortunately, not somebody was driving me, and I saw somebody escaping across the end of the drive, and somebody pulled them back, so they didn't get run over, because they were trying to get to the bus stop on the end of the drive. Because they thought if they didn't get to the bus stop, obviously the bus wouldn't stop them. He obviously saw them, and he kept going. It's a different story. What I'm saying is, the servicing of this all, taking out the hospital road, when you've got all sorts of people with all sorts of conditions getting over there, you're putting another complication in their lives. You know,
So certainly there's that one bus stop on Yamba Drive, but there is also a bus stop within the campus. I know that there have been works along Yamba Drive to try and support pedestrian safety and direct them to traffic lights and those kind of things. It's adjacent to near the car park, I believe it is. The multi-storey car park.
I believe there's two along that road, not one. But what I'm saying is not all bus routes go through there. It's very hard. Like if you're a visitor who didn't know town, you went to visit somebody in hospital, say, you know, elderly parent visiting sick child, son, adult son, and I'm aware of this happening. People are getting confused because the wayfinding isn't good enough. You've now closed Hospital Road. I'm not saying you personally, but a lot of people are finding that really annoying because it's making their life that little bit harder. I get a feeling you're going to hear a lot more about it through this process. I can almost promise it.
Certainly wayfinding and public transport are things that have been brought up. So as a part of this, we'll have those conversations. We've got our traffic consultants that support that as well, and we talk to Transport Canberra, so that how we can make that better for the community.
I've been accompanying my husband and using the hospital quite a lot lately. I've got a suggestion. I did notice that of your 6 aims, 3 of them relate to access and moving around in the hospital. The suggestion is that when people go to the hospital, they're usually sent there by a specialist or by their GP. If you had a series of handouts telling them what to expect, where they've got to go, and the sequence of events that's going to happen when they get there, then I think you're educating people before they get into a very complicated building, and I think that might help considerably. The painted lines on the floor are excellent, and the staff obviously know where you've got to go and what you've got to do, but it needs a bit more a simplification of the routes and certainly clearer marking. The sort of thing you might consider doing is different coloured areas at the hospital. So if you're in the purple area, you know that's concerned with this. If you're in the pink area, excuse me, choosing rather bright colours, if you're in the pink area, then you know it's concerned with that. So that you're trying to do this, I can see with the consultation, but you've got to put yourself in the shoes of the people who are trying to use the facility. My observation of the hospital, just an aside here, over the years is too much money in admin and not enough in the staff who actually deliver the service. That's just an aside. The second thing I'd like to raise is the relationship to Calvary Hospital and the relationship to the walk-in centres. That needs to be made a lot clearer to the community as to what the difference is and why you should be going to Canberra Hospital, why you might be better off going to Calvary Hospital, or why you should use a walk-in centre. It's a matter of information. People go into that hospital with, at least initially, with no information, or very, very little. And I think any way in which you can improve the way in which the information is provided to patients, then it's going to make the hospital flow a lot better. Right.
Thank you. And that's, I think I touched on that earlier on. It can be a stressful time when you're attending a hospital. What we want to achieve through this is future developments that decrease some of that stress and provide opportunities for reflection.
Move it back to when they first know they've got to go. Don't leave it till they actually get to the front door. I think that will
Thank you.
keep them forward.
Okay. We'll just have a couple of minutes to and fro. Quick questions. First of all, as a comment, it seems like this is really gentle stuff. I thought the hospital was rebuilt years ago, and you would have been well past the gentle chat to the community side, and you would have some really solid numbers, some solid directions and benchmarks against the whole regional plan. I mean, do you already have a health master plan in place?
So this is the development of the the Canberra Health Master Plan for the next 20 years.
Okay, so
certainly those things that I was talking about earlier, the territory-wide services plan, that is the planning for the hospital and the Canberra Health Service about the delivery of those critical and important health services, the surgeries, the surgeons, the doctors, the nurses. So certainly there is planning in those aspects.
I'm not understanding why we're starting now. I thought this is something that we've talked about spires and all these sort of funny names and things that have been going on for years. But my understanding I have to disclose that I was the architect, the ACG government architect on the previous redevelopment in the 1990s. So back in the day, it's appropriate at the times. So the way I remember it working is we had a health master plan, we worked out which services we wanted, how they were benchmarked against surrounding hospitals, and the efficiency of the hospital developments is basically the figure that we used to use is that the cost of building a hospital would be paid for in 2.5 years by operating costs. So the building was incredibly cheap. It was all about efficiency of provision, and then you come in with the service side from the community and everything, which is great. But really, there's so much solid homework you've got to do before you come along and actually lead the community. I'm just surprised that you're asking such open questions to a community group about their personal experience, because this is really just it's sort of like there's some nice little interfaces here, but the core of the expenditure and the real cost of operations is going to be through some hard-edge number crunching, which I would have expected already done.
And that work does happen, but equally, if we don't come to the community, that's really important to us, coming to the community and understanding the experience of people, as this lady was speaking about, who have used the service recently, have found these issues. So this consultation process is about understanding those and trying to respond to those at the same time. As I was talking about, we've got that territory-wide services plan, the numbers, the benchmarks, the number crunching, that also informs the master plan. And that will inform how and where we deliver services on that campus. But at the same time, we need to understand the impact that the campus has on people who use it and how we can make that as good as it possibly can be.
Quite frankly, I thought that would be a continuous operation. Now, surely you're reaching out to the community and constantly testing your relationship with them. Isn't that the role of the health department?
And this is the way that we're working through this process now. We've taken that decision to do a 20-year master plan, focusing on the campus, and this is the first stage of that through our consultation.
I find it amazing that it's a once in 20-year exercise and it's not continuous improvement. It should be something that's happening continuously, where you're asking these specific questions about your experience and testing it with the constituents and the users of the hospital. To me, any business that's running constantly tests their market, constantly does surveys, and constantly feeds that back into an improvement loop. I appreciate you coming along, but it's just the way you've labelled it as a 20-year beginning of a master plan exercise. To me, this is just, you should be doing this every year as part of your continuous improvement. And one of my questions is, well, how does the hospital and health system benchmark against best practice in Australia? And what are you doing as part of your real health planning to bring it up to standard? That's all this nicety about trees and parking. I want to be well.
Thank you for that question. It is a little bit outside of the scope, the clinical service delivery, the benchmarking process, but I'm happy for you to either give us your email address and we can have a conversation. I can put you in touch with the right person to help you with that conversation, or through Tom, and we can do that externally. I'm not the expert to be able to answer that question about clinical benchmarking, but I can certainly take that question on board and get others to talk to you about that.
So will this be a regular exercise, or is it once every 20 years you reach out to the community? I mean, maybe you just haven't presented it right.
So this is a plan for the next 20 years. We don't implement all of those things on the first year of implementation. So over that 20 years, there will be redevelopment, and we will talk to the community about this specific thing that we talked to about back in 2021. We've got the capacity and capability to do that now. This is how we think we're going to do that. This is how you feed back into that. CHS, Canberra Health Services and ACT Health Director do have feedback mechanisms and loops for the services that are provided. So that is happening every day of the year through the medical services, through the hospital, through the ACT Health Directorate, through complaints and issues like that. So always talking to the community around the services that are provided. This is a very specific thing about this is how we see our hospital developing over the next 20 years. When we come back and we develop those stages, we will talk to you again about how those might occur.
What's your program?
Beg your pardon?
What's your program? I mean, you have a program for development or redevelopment.
So the program, so that's what the master plan will deliver for us. The master plan will deliver a program of work based on the consultation that we have with the community and the territory-wide services plan data that we included.
You have a draft program before you enter into a $1 billion expenditure.
Thank you, and we haven't entered into that yet. I guess we're looking at two different ways of doing consultation. You would like us to come to consultation with a very explicit list of things that we're going to do or we're proposing to do. The way we've started this consultation is we want to hear what's important to the community. As I was talking about earlier, we've done a lot of work in the background, but it's not about coming to you with what the perfect solution might be, because that might not be the perfect solution for you or someone else. So it's wanting to understand what those touch points are for people and then responding to them through a master plan.
It's the hierarchy. I don't think there's anyone in this room who would say, I want trees and parking ahead of getting fixed and well. It's getting fixed and well. So I would expect that is such an obvious core value that hospitals fix up people and do some preventative stuff as well, that you would already have this nailed and you can talk to us about how you're going to improve things. And then we're going to put the icing on the cake with the access, the communications, the signage, the way the tram comes in and the buses park, and then how we stack the car parks up and have safety all the walkways and fill trees and all the rest of it. These are the peripheries that come with good design. So how are you going to make people well? What's the big improvement? What's the big issue here in terms of your master planning? Because you don't need us to tell you how to do it, because we're not medical specialists.
And that's what we're not asking the community for, that medical specialist advice.
Yeah, so tell us about it. Where are you off to?
Can I ask?
We might be not worried. Bill's got a question.
I've got a question that's coming electronically. just to remind you, everybody, there's another 10 people or so delivered into this home, so let's make it good for them. The question was, can you ask about drop-off and pick-up for people taking sick or injured children or elderly to the hospital? And I assume that's in the context, once again, of the plans for Hospital Road, that drop-off point. What I've heard is that they're saying there's going to be 15-minute parking limit there. That, in my head, doesn't compute. If you're taking somebody, a sick child, into a hospital emergency room where you might have to wait the rest of your life, I suppose, or rest right, or an elderly parent who might decide to wander off on you while you move the car to be compliant so that rapid parking inspector doesn't catch it. So I think it's feedback in. You're right.
Sorry, I've just got an answer to that. You can ask staff to call parking for a parking exception.
That was exactly part of my answer. So certainly, drop-off parking is an issue at many hospitals around Australia. So as a part of this, that's one of the things that we're hearing. We're looking at where that can be. The work done through the Canberra Hospital Expansion Project is also looking at pick-up and drop-off and parking points. It's making as many as them that is available and possible within the site that you have to do that, and also making improvements to accessibility parking, both on that Hospital Road side when that is reopened, and also on that the current emergency entrance.
I try and avoid hospitals wherever I can. However, I couldn't avoid it when I was escorting my very lovely old friend at age 93 when he died there last year, and we spent a fair bit of time there. Great service. I picked up on something you said earlier on. There aren't many places where you can go outside of the wards with people in the geriatric section or those approaching end of life or serious issues. Things like reflective gardens, that sort of area, green space. I fully support that because we did notice that sitting out the front of the current main entrance with people who are grieving, not a very pleasant experience.
Yeah, thank you. It's a couple of comments we've heard in a few different places now, so we're certainly looking how we can improve that.
Finally, I was the second hand up anyway. Yeah, I was late. I do have a concern when you go to the hospital. It's extremely difficult with the car parking. I don't know if you're trying to fix it up, and to get to the hospital, it's a mile walk from the car park to get into the building. And I'm just going to make a point about light. You can tell them the van might not put some legal anyway, so I worry about light. Just tell them to fix the buses because that's what everybody wants. But this is important that you're parking miles away from the actual building, a mile-long walk to get into the building, to get to wherever you want to. Maybe you want to go to the reception area or wherever, but it's the car parking part of it. It's really difficult to actually get in there. I have to go to that hospital. I'm glad I don't go to very often. If that can be fixed up, do you think?
It's certainly one of our focuses. It's one of the things that we've heard loud and clear. We will look to fix that. How we can fix that? Certainly there's some work going on at the moment about making a temporary car park over at CIT for staff. So that will remove staff car parking from, a large amount of staff car parking from the campus, and will support to make it easier for the community to park on the campus.
Can I ask a very basic question? Have you got a red line around the site? Sorry. Have you got a red line around that site? The reason I'm asking that question is, are you trying to cram too much onto the site? Has anybody thought about that? That's part of the reason I asked the question about the relationship to Calgary and the relationship to the walk-in centres. It's a very densely occupied site, and we need some green spaces for people to go and relax in and have a bit of a breather. But you're trying to get so much on there. As I say, is there a red line around it, and it's all got to go on there?
So, as a part of this, the focus is that campus. But certainly through our broader health planning, so the walk-in centre is a good example of that, about how you can move services that people might currently access on the hospital, how you can move them out into the community for people to access in an easier way that makes it both easier to access and removes some of the congestion on the campus. You might have heard about the government announcements for an electric surgery centre on the north side.
Yeah.
So again, that's moving some services that might not necessarily need to be on the campus into another part of Canberra, which decreases that congestion, if you like, around the campus. So certainly what services are provided there is a part of the territory-wide service planning approach that we go through.
So we have some clarity about where you go to do what, or where you go to do whatever's going to happen to your governments.
Got a question here?
Yeah, so I suppose almost in the opposite vein to that question, your answer to it, does the scope of this constitution process include the outpatient services that are offered on the Canberra Hospital campus? Because I suppose one of my concerns is that we have all these wonderful walk-in centres that are miles away, that if you come to the hospital because that's the only place you know to go to for healthcare aren't there, you'll be waiting in ED for hours and hours and hours, even before you need to do is see a nurse, and a walk-in centre style thing. And I just know that in Hunter, New England, they've had a lot of success with having walk-in centres and GP-run clinics semi-attached to their EDs there, and that's been and that we used to have that in Canberra. So I'm just curious as to whether the scope of this consultation process includes that style of thing, or is that not?
So we would be happy to take any feedback. So if that's something that you want to feed back to us, I've seen this operate really well in this place. Maybe you want to have a look at that. That's certainly a valid part of feedback that we'd love to take.
That's what I would like to do. Thank you very much.
Thank you.
I've got a question as well, which is just to ask if there's a staffing recruitment strategy that is in line with the master plan consultation, because understaffing is something chronic.
So there is a staff engagement approach through the master plan. So we want to listen to staff about what works for them and what doesn't work for them, because we want to make it a better place to work in, as well as a better place for them to receive their health services. So in terms of the workforce strategy, I'm not an expert on workforce strategy for health directorate. But again, if you like, yes, so there's work that occurs in that workforce strategy and culture within the health directorate. I'm happy to take that question and or take contact details and put you in contact with someone if you'd like to talk about that.
I'm going to have a go. Well, I'm very patient. I let everyone have their go. No more hands came up. So my question, Dave, is in relation to the strict structure of where you've located the master plan for. And I cannot, for the life of me, understand why the old CIT site has not been included in this, so you can plan for the future, you can spread out there with ancillary services. It's within close proximity of the hospital, and if you fix up some of the other things like access and parking, light rail maybe, or a better bus service, then I think you've got a really good area there. And it's something I've been banging on for a while before the CIT was knocked down. So I'd like to include that in there, to keep that for your expansion of ancillary and make the hospital for the major items. John?
Last one. I'm glad to mention that, Tom, because I totally support you on that. I think that's just an... I'm not quite sure what they've got planned for that site now, to be honest.
Temporary car park?
Sorry?
A temporary car park.
Temporary car park. God, we can turn it into a green car park while we operate here, but anyway, that's right, that'd be good. Yeah, what's a temporary car park? We've gone through that argument. Yeah. Well, look, I totally support Tom's comments on that, because land doesn't come up easily next to institutions. If I go back to the Prince of Wales Hospital in Randwick, most people here probably aren't familiar with it, but there was about, I think about 4 or 5, 6 hectare site next to that, which was the old Inglis horse sales complex, which is a fantastic place, a very historical sort of thing, right next to the hospital. The government in its greed sold it for residential, and that space is gone forever.
Now CIT appears to be sitting there as a space for the future, and I just think it, cries out for the government to keep it for, whatever else purposes in that whole complex. And I go back to my earlier comments about why would you run light rail away from the most busy part of Canberra?
Okay, thank you, everyone. The Your Say page, there's some great feedback which we're able to take down tonight, but certainly I'd encourage you, as you think about this more or you talk to others, to get onto that Your Say page. There's also an email address there that you can contact, and I'm happy to get contact details if anyone wanted some additional information.
Thanks, David, for that. We'll put the presentation up on our website and on our Facebook site. Yeah, we'll do that. Thanks for coming along tonight. We'll also put up in the morning the two consultations on Friday and Saturday, so that people are well aware of that. I appreciate that, and we'll see where we go with that. I'd like to now ask, firstly, Julia Jones, as I like to do, to ask MLAs who are here to come and speak for 5 minutes on whatever they would like to speak about. And take questions without notice.
Yes, questions without notice. Thank you, Tom, and thank you to everyone who's here and those who are watching through Facebook. What a great world we live in that we can watch this meeting from home as well as from the Weston Creek Community Centre. I just want to let you know a couple of things that have been happening that I've been busily involved in. The first one was that as Shadow Health spokesperson today, I had a great briefing from the Chief Health Officer about the rollout of the vaccine in the ACT. So if you've got any questions for me about that or about the different phasing of that, I've just got some up-to-date information today. And we've already got around 250 people vaccinated in 3 days. And we will continue to roll that out every day. Also, up in the Assembly, we're sitting through estimates and annual reports at the moment, which is usually 2 separate processes, but we're actually combining them into one, simply because we've got the annual reports that were brought down last year and the budget that was brought down this year to ask questions about, and I'm sure Emma will be there to answer some questions on mental health on Friday, so we have a very set program of who's doing what there. And I just also wanted to add my voice to the fact to thank Marissa for the motion to bring some funding for a Molonglo Valley Community Council, which I think is timely. As Marissa said, they're very different areas, Weston Creek and Molonglo Valley, both full of great people but very different character and very different age and very different makeup and so on, and different perspectives really. So this is a very established village over here, and that's a very new area, and they kind of have different things, and I'll be glad to see another body working on my electorate as well, so that we can hopefully get some of the many issues over that side resolved, as well as the good work that's being done on this side. Just want to let you know that during the last sitting week we also got an exemption for Convoy for Cancer, which I was glad to be able to go and chat to the Health Minister about. So that's going ahead in a couple of weeks if anybody's keen to be involved. And we also brought some motions about endemic poverty in the ACT, homelessness in the ACT, and issues at the AMC at the prison. So I realise they're not necessarily particularly local, but on the local stuff, the thing that I'm really pondering a lot at the moment is our crime issue here in Weston Creek. There is an impression that things have got worse. Certainly in some areas things have definitely got worse. I'm not really in a position to say across the whole board of the whole electorate, but certainly there are pockets where there are problems, and I'll certainly be raising that as we go forward in the next sittings as well. So happy to take your questions, but basically keen to do anything I can to assist in our area. Oh, and also, I just want to say thanks to Emma and probably to Marisa as well. We don't know what conversations go on behind closed doors, but the change of mind on the Coolo Park was no doubt a team effort.
from your representatives in the Assembly, and I certainly made it very clear that I wasn't backing down on that. Sometimes just some criticism on my own, not the other MLAs, but in the broader community. But I think the thing is, my biggest bugbear about it, apart from the fact that I thought it was not temporary and that wasn't really true, because that land would never be returned to how it is now, was the way people were treated in the consultation process. And I've had conversations with Emma and Marissa about this, that there are a number of Greens who have been elected to the government who, in my view, are there to change the way the government operates. And one of the key ways that I want to see change is on consultation. And I know David took some tough questions about coming with a soft approach, but when people go to a consultation and they're told what the answer already is, but asked what colour they want it, or what entryways they want to it, that's not a consultation either. So I actually welcome this discussion, the discussion about health. And I'm sure David's brief is very set, so it's not really up to him to change that brief, but that's where I can ask the Minister on Friday about that brief when she appears in estimates, and I will, and pass on some of your feedback and get some answers from the officials there, because once that decision was made to do a consultation, then someone in a department drew a line of where the consultation would be about, and that was no doubt given to David, and that's the information that he has to work from. He's not in a position to change that brief. So, but yes, I also probably would have thought, as Warwick said, that we had this kind of work done, and we have certainly done it before in the past. So yes, happy to take any questions.
No? Okay, all right. Thanks, Julia. I won't ask one. Emma, would you like to speak for 5 minutes, please? It's wonderful to have 3 MLAs along here. It really is. I can't remember the last, I can remember the last time, because it was probably last meeting. Thanks, Emma.
Thank you. Wonderful to see you all here again tonight, and hello anyone online. Look, I might take this opportunity to talk a little bit about community connection. One of the difficulties that we all had in 2020 was trying to maintain those connections to community that really help us in our physical and mental well-being, that really help our communities to be strong, resilient, and to function really well, and to be inclusive and enjoyable spaces for all of us. It was really hard with all of the things that were happening with COVID-19 and having to be further apart from each other. One of the things that we're trying to do is help all of those community groups that were disrupted last year to get back together again, and to do that in a COVID-safe way. So there are community connection grants that are available to community groups out there that are looking for a little bit of extra help, grants of up to $5,000, to help them enable people to connect in safe ways. It might be online, it might be in person, but you might need a bigger venue than you've previously had, or you might be needing to establish new activities for people to get together. This might be something that's related to education or arts groups, it might be sports groups or dance groups, it might be church or spiritual groups. There's a whole range of different community groups that we all participate in and belong to. And if you know of groups that are needing a little bit of extra help, if you go to Community Services website, they're open for grant applications until the 10th of March. You don't actually need to be an incorporated association to apply. No, not all community groups are. There's lots of very small, informal groups that would like a little bit of extra help as well. If anyone has any questions, I'm also Minister for Disability, Mental Health, Justice Health, and Assistant Minister for Families and Community Services. So if there's anything that you wanted to ask me, I'm also very happy to answer questions.
John, yes.
I just wanted to make a general comment, I think it's a breath of fresh air that Emma and Marissa have brought as new members, and I'm not saying anything adverse to you, Julie, at all. I admire the way you go about things as well. But Look, I've had a couple of instances where I've written things to them and they actually reply within a day. Maybe not the formal departmental reply, but at least a note to say they're interested in what you've said, and I just find it quite refreshing after one individual I could mention who doesn't reply to anybody, however long you wait. But yeah, well done and keep it up. Thank you.
Thank you. Look, while I'm up, thank you. Well, while I'm up here, can I just say it's really quite something to be part of an assembly where people are looking to work collaboratively with each other and work collectively to try and make our communities better. There's a number of MLAs in the assembly right now who are really interested in that kind of collaborative work, and I think it's a really good way for us to progress solutions to some of the big problems we're dealing with in our community.
A little problem, Emma, and I know you're already aware of this. It relates to bus design and moving the majority of the boarding to the rear door. Now, we're supposed to have disability-friendly buses. They've got a step. Now, some people are telling me they're struggling with that step, but they're also struggling when they go around to the front door if they get the driver to open it. Because all the smarties were in charge of the back door and got all the disability-friendly seating before they even get near the seats. And this, as the traffic is building up and people are starting to get back on the buses, get more confidence, this is becoming quite an issue. So I'm just leaving it with you, and I know we're writing a note to you, that it's bringing out as well.
Yeah, I do know what you're talking about. I'm a regular bus user myself, and I've seen exactly what you're talking about with people struggling to use that rear entrance if they've got mobility issues. I did notice there's a Your Say panel survey out at the moment that actually asks that specific question about front and rear door access. And I have noticed that buses are starting to use the front door again, which is really good to see. But yeah, I can certainly pass that feedback on to Chris Steele's office as well. Yeah.
Hi, maybe a bit of a thorny one, so I'm really sorry, because it's fantastic that you've done this, so thank you so much for that. This is a question of mental health act, so I'm really sorry again. There's a bit of a problem in Canberra where a lot of people are being detained under the act who don't need to, who are voluntarily calling ambulances, asking for help with their mental health conditions, and being brought in and involuntarily detained under the Mental Health Act, even though they are asking to come to hospital. I was just wondering what we're doing to decrease that and stop people being having their human rights taken away, because we have a human rights charter in the ACT, stopping preventing people having their human rights taken away when that's not necessary.
Actually, I'd really like to hear a little bit more about what that situation is and how that's happening. I did notice that there was a real change in that situation with the introduction of PACER, because ambulances were going out with a mental health clinician and a police officer all together, and that was actually helping quite significantly. But would you mind telling me a little bit more about what's happening with those involuntary situations?
Yeah, sure. So under the Mental Health Act, if somebody is under one of the interpretations of the Mental Health Act, it's the interpretation that is being used by ACT Ambulance and also the police, is that anybody who is contacting them for help with a mental health condition, regardless of whether or not they are refusing care, they are being brought in under, I think it's not an emergency, an EA, it's emergency apprehension order, which is being detained under Mental Health Act and being brought to the Canberra Hospital for that reason. And then they need to be reviewed by Dr. Knowledge as. But I was just wondering, the point of the question is that even that short period of detention is detention under Mental Health Act and does impact your ability to get a visa overseas and that kind of thing. And that's sort of my concern.
Yeah. I know I did get a briefing on this recently. If you wouldn't mind sending an email to davidson@act.gov.au, I can give you a good detailed response to that.
Thank you very much.
Thank you.
So on that question, Emma, because it was from last term when you weren't there, There were some conversations about the fact that it was maybe being done because it was the simplest way for those service personnel to bring them to hospital. They also got more direct entry, but it isn't necessarily the right use of the Act. I agree with that, but I think there are some reasons why it was occurring that needed to be resolved.
Yeah.
Nora?
I do health as well, or just mental health?
Mental health and
Because I've got
disability.
issues with the health side, so that's not the right person.
You know what though? If you were to send me an email, I could pass it on to Rachel Stephen-Smith. Yeah, I do talk to Rachel very frequently, so happy to pass things on where it's actually more her area.
Okay, thanks Emma. Thanks very much for that. There we go. Okay. On time. Amazing. We've got the minutes of the last meeting. I think they've been distributed.
I've got an error, can I tell you?
No, you can, what's the error?
The error is on page 6. The question, the second question, the review of the ECBC, I think that should be EPBC.
Okay, we'll make a note of that. Can I get someone to move that they be accepted? Pat? Or John? Yeah, John Davis. Seconded by Pat. Thank you, Pat. Yes, all right. The Treasurer's report, our Treasurer isn't here. The main account, $15,893.23, and Featherston Gardens, $8,862.74. That's just for noting. I'll go on to general business because I'm conscious of the time. Malongo Valley Community Council, in our email out, we wrote about this and said that we're pretty proud about what we did for Malongo over 10, 11 years now. I think the first time we started working on it was 2010 or 2009, can't remember, but I do remember sitting on a planning group for the town centre, and hopefully we'll see it built or started to be built soon. But we're really pleased that the group has finally got together. I think this is about our third go at trying to organise a group to form a community council out there, because really they need to be on the ground, as Marissa has said and Julia has said, to look after their own patch. I mean, we're pretty happy that we have a very good bus service into the city from there. That was the efforts of the council, the bridge over the Malongo River, and the aquatic centre going back ages. We still lament the lack of shops in Wright and Coombs for the people who live there, but we're hopeful that Coco will be up and operational by 2022. We spoke about the Watling Place car park. I can't thank our MLAs enough, and the group, the Save Colo Park group, and the work that they did, and the petition that was run by Carolyn Makuta, which gathered over 1,200 signatures. All of that added to the ability to get it changed. And John, you're right, it was changed when the master plan was produced in 2015, I think it was, and it went from open space to community zone land. So, in my view, it's been open space for a lot longer than it's been community zone land, and I'd like to see it go back to that as well. Greeley Street, we've touched on the funding from what was to go to the car park and will go to the upgrade of Greeley Street. We've done an initial survey on that. We're going to talk about that next month, Bill, aren't we? Yes. And what we'd like to do too is to go out again with another survey once we've been able to digest the comments from people. The budget, well, we say it's disappointing, well it is, but it's last year's budget. People got to remember that. We will get upgrades to the Duffy shops and the Duffy Primary School, and the Arrowang netball facility in Stirling. We'll get some funding for that. And there's a new intersection in Stratton Drive to improve safety. I can't remember which one that is. I think it's, they're putting lights at Namatjira, I think. But there's a lot of commentary about whether we should go back to the 2 lanes that approach Mully Street, because that's pretty dangerous there. And we'll see where that takes us. The bridge over the Longbow River, that's great. The DA has been approved for that with a number of conditions, but it's been approved, so hopefully that will go ahead and provide a second route north-south. We've got a few other things. Marissa mentioned the mural on the western wall of Coolman Court. It's terrific. Wonderful bird life there. It's really good. And I think that was courtesy of the government. Yeah. Yes. And that's about all from me. So I'm happy that... one other thing. The old AFP site and the ACAT case, which I think we had our last hearing date 12th of December. Pat, I didn't want to really remind you of the 12 days we sat there, but when you talk about the planning laws and what needs to be done, I think we had a page of words and there were arguments over what they actually meant without even getting into the law. And we sat through 12 days of this. No decision as yet, so it's over 2 months after the case was adjourned, and I don't know where it's going to go to from there. So I don't know when an answer is going to come out from that. We just have to rely on ACAT to do that. And if anyone's got any other questions.
Did you say you had a problem with Facebook?
Beg pardon?
Did you say you had a problem with Facebook?
Yes.
What happened there?
Oh, we just...
Now, isn't it? Yeah.
It's working now after a lot of work by Bill, but in reality, we just cut off.
You were cut off from Facebook at the beginning.
Yeah.
So we got back on.
Yeah. It took us...
Can you say something?
Yeah. Bill can answer this much better than I can.
Yeah, Nora, I think they thought we were in news outlet. I think they thought we were in news outlet. So a lot of playing around with it, played around with settings, sent a lot of annoying notes that they didn't reply to. And I said, hey, we're a little community group. And then I changed the organisation purpose in one of the settings. And 2 hours later, it worked. And I got that tip from a friend who works on the help desk.
Right. Okay.
Thanks, Bill. John?
Tom, I'd just like to compliment some of the things that have been done by the council in particular, but also while we've got 3 members of the assembly here, it's very easy to knock, and I probably knock as much as anybody, be negative about things, but look, there are good things going on around the place. The new playground near the Warramanga shops, which is wonderful, really, really wonderful. The walking tracks and riding tracks below, on the river edge, below Coombs and Wright, or below Coombs at least, fantastic. It's really a great achievement, and it's used by many people, including Parkrun, which I'm involved with on a Saturday morning, where over 200 people use that for an event. It's much appreciated, and it's just added a lot to the area. I tend to sort of think of Molonglo and Weston Creek together, but yeah, I think it was time for them to get their own council going. There's very different people over there, completely different sort of ethnic mix in some ways, but also in age. They're a lot different from sort of composite. A lot of us who are all sort of probably on the elderly side. So I think it'd be good for them to do their own thing. But compliments to the council for the things they've achieved, and like I say, I think it spreads the benefit not just to Molonglo but to Weston Creek and vice versa. Thank you.
Thanks, John. A couple of other things I forgot to mention. There will be some works going on Managera Drive between Highmast Drive and Streeton Drive. Road calming measures. I don't know why they're putting them there. They should put them on Streeton Drive from Darwinia Terrace down to Highmast Drive. But that's another question. What was the other one? The other one was, my favourite, another one of my favourites, Western Ponds. You can go on all sorts of tracks, as John has said, in Coons, but you walk on the grass and the weeds and the dirt, which is an unmade track, around Western Ponds. And if... Oh, I'm not worried about that. I'm worried about a path around the ponds for people to exercise. And somewhere to sit would be lovely. With that, that's another one of my pet ones, like the CI2 side.
We've got a new bike path over to Lions, which we lobbied for, and we've also got a new piece of bike path along John Gordon Drive coming towards the Street and Drive area.
That connects up the missing link along there, I think, yes. So some of the things that we've worked on, we worked on the bike path over the Lions, and we didn't want the original route and talked to the equestrian people and pedal power. I think the three of us agreed and it was changed, which is great. So people are listening to us, and it's a question of having people on side with you so that you can go as a group to talk to government. If there are no other questions, I will say thank you all for coming. And our next meeting is on Wednesday, March 31st. We will have Capital Estates coming along to talk about the next stage of Denman Prospect. Yes, it's a bit of a hangover, but I owe them a spot to talk. And we'll talk about Reilly Street and our survey and what we found with that. So thank you all. Good night. Thanks again, Marissa, for speaking, and Julia and Emma. And David, thank you.